Hi, everybody. I want to take a few minutes to talk to you about something that I find very interesting, and I think you will too. It's called masculinization, and it has to do with cosmetic surgery and cosmetic procedures for men. Now, the term has been used and can be used in transgender surgery, but although that's a wonderful thing, that's not what I'm talking about. I'm not talking about surgery on gay men either, although that is very popular, and I totally support that. I think it's wonderful. What I'm talking about here, when I use the term masculinization, is cosmetic surgery and or procedures for straight men that want to have a more masculine look. It's kind of like the latest thing in cosmetic surgery, and it's gaining popularity. Now, men for a long time have been doing Botox. Well, at least in Boca Raton. And there's nothing wrong with that. We call it Brotox, and I have reported on that before. I think that's fantastic. But now, men are starting to learn that they can do even more. And they might be learning this from their female partners. They're also doing fillers now, along with the Botox, and they're starting to get into some facial cosmetic surgery as well as body treatments. So I recently did an interview with Dr. Albert Vaca, a prominent plastic surgeon in Boca Raton, and he talked about this new trend, masculinization. So take a look.
Masculinization procedures, for example, where men want sort of a wider
Masculine-
jaw.
What did
And
you
so-
say? Masculine?
So enhancing male features.
Okay.
That's the best way to put it.
I like that. So
And
you
so-
can give someone a square jaw. Like
So
a
yeah,
Brad
those can be
Pitt
done as
square
well.
jaw.
So typically, but that can be done either with facial implants or fillers can be used as well.
And how much downtime is there with facial implants? Is that like...
Well, if it's just a facial implant procedure, say two to 3 weeks.
Oh, that's not
On
bad
average
at all.
for most things. Of course, healing continues, but
Yeah.
in the point where about 80-90% of the swelling is gone and people can go out in public and not really notice, approximately that
Wow.
range.
That's not bad
Yeah.
at all. Men can also address their bodies. Not just because they may be unhappy with the way they look, but as we age, men and women, things seem to shift around. Fat deposits end up in places we don't want them. Of course, liposuction, taking off fat in areas where we don't want it. Good for women, good for men.
Tummy tucks, body contouring, which essentially means just reshaping the body, typically via liposuction. Taking fat away from some locations and re-injecting it in others.
And sometimes men can kind of develop male breasts. The fat is removed from the breast area and that area is tightened up. That can make a huge difference. Another thing men can do that can make all the difference in the world is a hair transplant. If they have thinning hair or if they're bald, you would be amazed what can be done now. And that is probably like the number one thing. If someone's wants to look younger or just wants to look different or wants to look better, nobody's judging you. You do whatever you want. But hair transplants these days are simple and very, very, very effective. I don't know if you do hair transplants.
The way that has advanced back, be it a decade or more ago, people used to have that stereotypical incision that go across the
Yep.
back of the head, which was very kind of a stigma, if you will, of
Yeah.
that surgery. But nowadays, essentially a lot of them use a robot, which takes small little
Oh.
hair follicles. In other words, it produces a bunch of tiny little scars, which are imperceptible
Oh,
because
you
they
wouldn't see
harvest
them.
individual hair follicles, or 2 or 3 at a time, and then transplant them.
Okay.
And then also the nuance of knowing how to implant them
Right.
versus the Ken doll or the
Right.
sort of doll hair
The
where they
rows
would have
of,
like 4 or
corn.
5 hairs. It's actually distributing them in a little bit more of an artistic way.
This is so exciting. We don't
Yeah.
really have to age.
So
do we?
there's, of course, plastics involves literally head to toe. There's a lot to know.
Another thing that can be addressed are noses. Sometimes just a little tweaking of a man's nose can make all the difference in the world.
Just the nuance of reshaping, and it's just a matter of millimeters.
And
There's
it
a
can
lot of
make
art to it.
such a difference.
It really can. It really
Yeah.
can. Because it's not just reshaping the nose, it's keeping in mind how that affects the rest of the facial
The
proportions.
proportions. And ears can also be addressed because men usually have shorter hair, and sometimes as we age, ears seem to get bigger or bend out a little bit. All these things can be tweaked just like women do, and there's nothing wrong with it. Okay, so your patients, for example, if they're getting maybe a full facelift, you would keep them overnight?
outpatient surgery center, people go the same day. Every once in a while, if someone has a little bit more invasive procedure or other things done at the same time, then they may stay overnight either at a care facility. Oh no, typically they go home.
They go home?
Sometimes it's based on patient preference, or if they had another conjoined procedure, and then we just sort of balance and have that discussion with the patient.
Okay, so it's not that big of an inconvenience
Yeah,
anymore.
the majority, by far the majority of people can go home the same day.
Wow.
The art of plastic surgery, I think, is making a profound change, but leaving as little evidence that you were actually there.
Right, nobody
That's
should
really
know.
the whole trick of it.
Your best work goes unnoticed.
Yep.
Wow. Okay, so this is an emerging field of cosmetic surgery and cosmetic medicine. I have heard a term masculinization package, which includes the jawline, the chin, and the cheekbones, which all can be augmented with implants and or fillers. Men might also want to consider a facelift or lower facelifts. There are amazing things going on now in cosmetic medicine. There are even non-surgical alternatives that can lift up your skin and make you look a little more youthful. Skincare also is very important. There are a lot of products out there for men. So what I'm saying is, men, you've heard the term metrosexual. That's an old one. That goes back 10 or 20 years. But this is masculinization, totally different term, and I think it's something that's going to become really socially acceptable over the next few years. And many men are doing masculinization not just to completely change their looks, but for age management. Because like women, as we get a little bit older, we lose a lot of the volume in our face. Things seem to like hollow out, and we want that youthful, fuller look, which can easily be achieved, just like it can for women. Men can do it too. I always say that people in Boca Raton are ageless. It's kind of an ageless city because a lot of women in Boca Raton do take advantage of cosmetic medicine, facelifts, injectables, tweaking their body. It's all available here. It's definitely up to you. If you feel good in your skin the way you are, then by all means, nothing is more important than self-confidence. But if you want to take advantage of what's out there cosmetically, men, you can jump on the bandwagon too. Okay, everybody, I hope you found this interesting and informative. I just wanted to bring you this little segment because I was interested myself when I found out that men are now doing a little more plastic surgery than they used to. Just like women, if there's something you want to change about your appearance and you can do it, and it makes you feel good about yourself, do it. Nobody's stopping you. So, all you men out there, I don't see anything wrong with doing a little tweaking, changing a few things, getting a facelift. That's perfectly fine. It's not like the old days where you have to go away and hide for weeks or months, and you can get right back into your life, sometimes within a few days. Okay, everybody, see you next week.